Welcome back our fans. Part 2 General Anesthesia. 4 Intubation. Procedure that is used when patient can't breathe on his own. A tube is put down through throat to be able to get air into and out of your lungs. Machine called a ventilator pumps in air with extra oxygen, oral or nasal. Risks of intubation. 1. Anatomic factors Mallampati scores. 2. Limited opening. 3. Edema. 4. Mobility of neck. 5. Size of tongue. 6. Dental status. Methods. In case of difficulties. 1. Fiber optic intubation. 2. Blind nasal intubation. 3. Preoperative tracheotomy. 5. Maintenance. Operating position. Used position is semi-supine. In this position, erect head and neck helps in maintenance of airway. A. Intubation without neuromuscular blocking agent, short. Operation. Spontaneous respiration of inhalational agent, nitrous oxide. And oxygen, 50% inspired oxygen concentration, decrease. Hypoxemic episodes. Continuous, controlled infusion of propofol or etomidat or thiopental. B. Intubation with neuromuscular blocking agent. Non-depolarizing neuromuscular blocking agent tracheum. Norcuron. Depolarizing. Is not recommended, for example, succinylcholine. Because of muscle pains. Anesthesia is maintained with administration of halothane/sevoflurane and nitrous oxide and oxygen. DIC low Fe NAC and DITA XAM ETHASONE a re-ADM inesti red to reduce pain and swelling. Local anesthetic is commonly infiltrated by the surgeon. More extensive procedures, short-acting opioid like fentanyl is administered. 6. Free airways. Pharyngeal pack is removed. No bleeding. Extubation. After the return of protective reflexes, muscle strength and sufficient spontaneous breathing. Presence of the surgeon. Extubate under constant suctioning. Recovery. Endotracheal tube should not be removed until cough reflex has returned. Prerequisites of extubation. Sufficient spontaneous breathing and return of protective reflexes. Antagonizing. Opioid with naloxone. Non-depolarizing neuromuscular blocking relaxants with cholinesterase. Possibly delayed extubation due to risks of free airway at laryngospasm. Bleeding in mouth. Bleeding between soft tissues, compression airway obstruction. Obstruction caused by edema. Backwards falling of tongue. 8 complications. 1. Hypoxemia. 2. Arrhythmias. 3. Dislocation of temporomandibular joint. 4. Tooth fracture. 5. Bleeding. 6. Mucosa injury. Malignant hyperthermia. It is a rare, inherited musculoskeletal syndrome that presents as a hypermetabolic reaction triggered by exposure to volatile anesthetic gases, for example, desflurane, halothane, sevoflurane, or depolarizing muscle relaxant, succinylcholine. Signs of MH include muscle rigidity, rapid heart rate, high body temperature, muscle breakdown and increased acid content. Management, dantrolene and supportive care. Succinylcholine apnea. It is abnormal prolongation of action of succinylcholine, due to failure of body to metabolize it, leading to sustained paralysis. Metabolized by plasma cholinesterase, also known as pseudocholinesterase. Treatment. Fresh plasma transfusion from non-deficient person. Continue controlled ventilation till full recovery. Recombinant pseudocholinesterase administration. Neostigmine. 9-GA in outpatient surgery. Surgical procedure usually lasts not longer than 1 hour and there are no anticipated postoperative complications. Advantages: cost savings, conserving hospital beds for other patients, suitable conditions for surgeon during surgery, reduces psychological burden of patients. Types: A. Relative analgesia, inhalation sedation technique. B. Conscious sedation. Relative analgesia. It is an inhalation sedation technique, which is administered by placing a small hood over nose only. It delivers oxygen and nitrous oxide, laughing gas, which patient inhales in a normal breathing rhythm. This produces, after a short time, pleasant tingly feelings in hands and feet, which then progresses to equally pleasant feelings of warmth, euphoria and reduced anxiety levels. Commonly used with child patients and adults who are anxious of having dental treatment, simple procedures as tooth extraction. Conscious sedation. It is a technique in which use of a drug produces a state of depression of CNS, enabling treatment to be carried out, but during which verbal contact with patient is maintained throughout period of sedation. It may be induced by any one of following modalities: oral administration of a single sedative drug, midazolam, diazepam, nitrous oxide and oxygen inhalation, combination of oral sedative drugs or nitrous oxide and oxygen with oral sedative drug, parenteral administration of sedative drugs, intravenous midazolam, propofol, intramuscular, subcutaneous, submucosal or intranasal midazolam. After care. Patients are ready for discharge. They must be accompanied by a responsible, legally competent adult who has been given clear instructions regarding implications of anesthetic effects. Thanks for watching. Support us by likes and subscribes.